Hi students, welcome to short answer series. Today's topic of discussion is angiogenesis. Angiogenesis is a process of new blood vessel development from the existing vessel. It is important in the healing at sites of injury, in the development of collateral circulations at sites of ischemia, in allowing tumors to increase in size beyond the constraints of their original blood supply. Coming to blood vessel, this is a blood vessel, that is an inactive vessel, where you can see the red line is basement membrane, and here a small mistake happened. The pink color cells are endothelial cells towards the lumen, and abdominal side you can see the blue color cells are pericytes. Now, because of angiogenic factors like vascular endothelial growth factor, vasodilatation happens, and here there is degradation of basement membrane, this basement membrane red color thing, and there is detachment of pericyte, that is the blue color cell gets detached from the basement membrane, and here the green color cell is nothing but the endothelial cell which is proliferating and it is migrating towards the site of injury. Now here you can see there is elongation of this vascular stalk and there is pericyte recruitment. Many pericytes are coming. Here the new blood vessel formation happen. Now steps involved in angiogenesis are vasodilation in response to nitric oxide, and there is increased permeability which is induced by vascular endothelial growth factor, as I've already mentioned. Now there is suppression of pericytes from the abdominal surface, breakdown of basement membrane to allow formation of vessel sprout, migration of endothelial cells towards the area of tissue injury, and proliferation of endothelial cells just behind the leading tip of migrating cells. All these things I have already mentioned in the diagram. Now, remodeling into capillary tubes happen. There is the recruitment of periendothelial cells, that is, pericytes for small capillaries and blood smooth muscle cells for large vessels to form mature vessel. There is suppression of endothelial proliferation and migration and deposition of the basement membrane. The process of angiogenesis involves several signaling pathways, cell-cell interactions, extracellular matrix proteins, and tissue enzymes. We'll see one by one in the upcoming slides. The growth factors which are involved are vascular endothelial growth factor, mainly 1. It stimulates both migration and proliferation of endothelial cells. It promotes vasodilation, as I've already mentioned. Then fibroblast growth factor, mainly SEC2. It stimulates proliferation of endothelial cells. They promote migration of macrophages and fibroblasts to the damaged area, and it stimulates epithelial cell migration to cover epidermal wounds. Now, third growth factor is platelet-derived growth factor and transforming growth factor beta. They participate in the stabilization process. Platelet-derived growth factor recruits smooth muscles, and transforming growth factor beta suppresses endothelial proliferation and migration, thus enhancing the production of extracellular matrix proteins. Coming to pathways, here we have notch signaling pathway. It regulates the sprouting of the endothelial cell and branching of new vessels. Then we have extracellular matrix proteins. They participate in the process of vessel sprouting by interaction with integrin receptors of endothelial cells and by providing the scaffold for vessel growth. Coming to enzymes, we have matrix metalloproteinases that degrades the ECM to permit remodeling and extension of the vascular tube. Note, these newly formed vessels are leaky because of incomplete interendothelial junctions and because VEGF increases vascular permeability. Thus, this leakiness causes edema that may persist in healing wounds long after the acute inflammatory response has resolved. Please subscribe to my channel for getting more updates on such videos. Thank you.